Today, we're diving into a fascinating study about electrolyte imbalances in emergency department patients. Let's get started.
I'm excited to hear about this. So what's the main takeaway from the study?
Well, the study looked at 996 patients admitted to an emergency department in Turkey and examined their electrolyte imbalances.
Interesting. Which electrolytes were they focusing on?
They mainly focused on sodium, potassium, calcium, and magnesium.
Right.
The usual suspects when it comes to electrolyte issues.
Yeah, those are crucial. So what were the most common imbalances they found?
Actually, hyponatremia was the most frequent, occurring in 60% of the patients.
Wow.
That's a pretty significant number.
Definitely. Did they mention common symptoms associated with these imbalances?
Yes, the most common symptoms were dyspnea, fever, and systemic deterioration. And confusion was a prevalent finding in physical examinations.
Confusion makes sense with electrolyte disturbances. Did they note any comorbidities?
They did. Interestingly, 39% of the patients had malignancies. That's a pretty high
Really?
rate.
Yeah, that's higher than I would have expected. Do you think the malignancies contributed to the electrolyte issues?
Absolutely. Malignancies can disrupt electrolyte balance, especially calcium
Right.
levels. In fact, hypocalcemia was found in 51% of the patients.
Over half the patients had low calcium? That's significant.
It is. And they also found that hypocalcemia was associated with confusion and other neurological symptoms.
Makes sense.
So it's a multifaceted issue.
Did the study mention ECG findings? I'm curious about cardiac effects.
Yes, they did. The most common ECG finding was normal sinus rhythm, but tachycardia was seen in 24% of patients and atrial fibrillation in 7%.
Atrial fibrillation? That's significant. Electrolyte imbalances can definitely trigger arrhythmias.
Exactly. And hyperkalemia, present in 8% of patients, can lead to peaked T waves and other ECG changes.
Right.
Monitoring electrolytes is crucial.
Definitely. What were the most common diagnoses among these patients?
Sepsis was the top diagnosis, occurring in 11% of the patients,
Wow.
followed by pneumonia at 9% and acute renal failure at 7%.
That makes sense. Sepsis can really throw off electrolyte balance.
Yeah, it's like a domino effect.
Exactly.
Once the body starts to go into shock, everything gets out of whack.
So what does this mean for emergency physicians?
Well, the study emphasizes that ED physicians need to be very aware of fluid and electrolyte dynamics. It's like trying
Right.
to balance a seesaw that's constantly moving.
That's a good analogy. You fix one side, and the
Exactly.
other side shifts.
Exactly. Timely correction of imbalances can be life-saving,
For
especially
sure.
in critically ill patients.
But don't you think that focusing too much on electrolytes might distract from other critical assessments?
Well, I see your point, but electrolytes can have a huge impact on patient outcomes.
True.
Ignoring them could be detrimental.
Fair enough. It's about finding the right balance.
Exactly. While we can't overlook other assessments, electrolytes are a key piece of the puzzle. They
Right.
can influence so many body systems.
Absolutely. Electrolyte imbalances can be easily overlooked, though.
Yes, especially when patients present with vague symptoms,
Right.
like weakness or confusion.
So, in practical terms, ED physicians should have a high index of suspicion.
Exactly. It's better to err on the side of caution.
Agreed.
And considering the cost and availability of electrolyte tests, it's a feasible approach.
Definitely. So, any final thoughts on the study?
Well, I think it underscores the complexity of emergency medicine.
Yeah,
There's so much going on with each patient.
absolutely. Sometimes it's like being a detective, piecing together clues.
Exactly. It's like solving a puzzle,
Right.
and electrolytes are often key pieces.
Well said. So, I guess the takeaway is to keep electrolytes on our radar?
Definitely. And to remember that small imbalances can have big effects, especially
Exactly.
in vulnerable patients.
Well, this was a great discussion. Thanks for bringing this study to our attention.
My pleasure. It's always exciting to delve into the nuances of emergency medicine.
Absolutely.
Until next time.